Learn everything you need to know about the Wells criteria for pulmonary embolism in a way you will never forget. First of all, look at the patient in the image. She is short of breath, appears uncomfortable, and is complaining of chest discomfort. But the important point is that we should not diagnose pulmonary embolism based on symptoms alone. We use the Wells score to estimate the clinical probability of pulmonary embolism. Now let's go through the criteria one by one. First, look at the patient's legs. If there are clinical signs of deep vein thrombosis, such as unilateral leg swelling and pain along the deep veins, add 3 points. Next, ask yourself an important question. Is pulmonary embolism the most likely diagnosis? If PE is considered more likely than any alternative diagnosis, add another 3 points. Now look at the monitor. A heart rate greater than 100 beats per minute gives 1.5 points. Notice that a heart rate of exactly 100 doesn't meet this criterion. Next, think about recent immobilization or surgery. If the patient has been immobilized for at least 3 or has undergone surgery within the previous 4 weeks, add 1.5 points. Now ask about the patient's history. A previous episode of DVT or pulmonary embolism gives another 1.5 points. If the patient has hemoptysis, meaning coughing up blood, add 1 point. And finally, if the patient has an active malignancy, meaning cancer that is currently being treated within the last 6 months or receiving palliative treatment, add 1 point. So remember that the Wells criteria like this: 3 points for clinical signs of DVT, 3 points if PE is most likely diagnosis, 1.5 points for heart rate above 100, 1.5 points for recent immobilization or surgery, 1.5 points for previous DVT or PE, and 1 point for hemoptysis, and 1 point for active malignancies. The total score helps estimate the probability of pulmonary embolism and guides the next diagnostic step. And one important point, the Wells score doesn't confirm pulmonary embolism by itself. It's a clinical prediction rule used to estimate pretest probability and decide how to proceed with further testing, such as D-dimer or imaging.